So this is the second system, which is a musculoskeletal system, and in this part we are going to learn various fractures, arthrocentesis, arthroscopy, and all the treatment related to the bone and the muscles. So let's begin. So we have seen the incision and drainage codes in the integumentary system, that is a 10,000 series. But we do also code incision and drainage in the musculoskeletal system. So whenever the basic incision and drainage procedures are done on the skin, it is limited to only the epidermis and dermis, and to some extent the subcutaneous tissue. But below the subcutaneous tissue, a layer of the fibrous tissue called as a fasciae, and then you have the muscles and the bone. So when it reaches the fasciae, it marks the beginning of the musculoskeletal system, and that means that the code for the incision that goes through the fasciae is we have to code from the 20,000 series. So whenever you are attempting the question, please pay attention to the depth of the incision, because that will decide your code whether it is a 10,000 or 20,000 series. So Mike had a bicycle accident and suffered a deep hematoma in both the knees. He underwent a bilateral incision and drainage. And how would you report the procedure code? So let us see what is the first code, 27301. It talks about the incision and drainage, deep abscess, bursa or hematoma, thigh or knee region. 10040, it talks about the acne surgery or acne surgery, and it is mainly the integumentary system. Now check the code 27303. It is an incision deep with the opening of the bone, cortex, femur and knee. Now nothing like that happened, because in our case they have just checked the deep hematoma and then they have incise and drain. 27301, it is with the modifier 59. Now in our patient case we have carried out the hematoma drainage not on one page, not on one knee, but on both the knees. So let us see what's our answer. So the final answer is A. 27301 is the code for the incision and drainage of the hematoma, and we will have to put the modifier 50 because it has been done on both the knees. So this is our answer. Now the next important subheading is the excision. Excision is basically when you take out that particular lesion or the tumor or whatever the cyst. Now as far as the excision is concerned, we have to identify the anatomical side. Then we have to see how the excision has been carried out, whether did you carry it out open, percutaneous, and whether the biopsy has been done. If the excision and the biopsy is done on the same lesion, then we will code only for the excision. Remember that. Now let us understand the guideline of the excision with repair in as far as the skeletal muscular system is concerned. Now in the integumentary system, what we have learned is whenever there is a simple repair that has happened with the excision, it is included. But we code the intermediate and complex repair separately because it is not included in the excision. Now as far as the skeletal-muscular system is concerned, both the intermediate and simple repair are included for the same site. Okay, this is very, very important. And so I have put the asterisk on that. Identify whether the excision is made up to the muscle level or not, because if it is not up to the muscle level, we can always code from the integumentary system. Identify the purpose of the excision, whether for the biopsy or removal, and eliminate the 10,000 series. Lead the code based on the depth. More the depth, come into the skeletal muscular system. As simple as that. So let us take one example where they will test this guideline. A 52-year-old female has a mass growing on her right flank for several years. It has finally gotten significantly larger and is beginning to bother her. She brought to the operating room for a definitive excision. An incision was made directly overlying the mass. The mass was down into the subcutaneous tissue, and the surgeon encountered well encapsulated lipoma approximately 4 cm. This was excised primarily bluntly with a few attachments. divided with the electrocautery, what CPT code should be reported. And we have the different CPT code. The first is biopsy soft tissue of the back or the flank. Now in this case, what did they do? They have done the excision. So 21931, it is for the excision tumor soft tissue of the back and flank, subcutaneous 3 centimeter or a greater. 21932, excision tumor soft tissue or the back or flank subfacial, that is intramuscular, less than 5 centimeter, and this is a radical resection of the tumor. Now in this case our thing was down into the subcutaneous. Down into the subcutaneous is basically in the fascia region, and we have the thing as a lipoma. Lipoma is never that superficial, it is usually the fat tissue tumor. So we have to take that into consideration, and that's why we are coding from the 20,000 series. So we will code 21931 here, and it talks about the excision of the tumor soft tissue of the back. Where did it happen? It happened in the back right flank area, so that is also covered, and 3 centimeter or greater, and our diameter is 4 centimeter. So I can take up the code 21931. So let us take one more question. A general surgeon performed a deep biopsy of the soft tissue lesion in the area of the patient's shoulder. The procedure was not a needle biopsy. While the patient is in the operating room, the surgeon also excised a small 1 centimeter benign mass from the patient's right hand. How should the service be reported? Now we need to code for the two things. One is the shoulder biopsy and then the benign mass excision from the right hand. So the answer is the B answer, where we are coding the 23066, that is the biopsy soft tissue shoulder area deep, and 11421, it is for the 1 centimeter benign mass from the patient's right hand. And we remember that whenever we are coding for the any excision, we we look for the three things, whether it is a benign or malignant, from which area it has been excised, and what is the diameter, and all that thing. If we put it, 11421 is the correct code, because it talks about the area, that is the hand, it is included, benign lesion is included, and the diameter it is included. And remember why we are coding this excision separately, because excision plus biopsy, we only code for the excision, but that we will code when both the excision and the biopsy happened at the same site. Here the site is not same, one is shoulder and the other is hand, so we need to code for both, and that's why the answer is B. So let us take this example. A 19-year-old male college student bumped his right thigh while playing intramural rugby on the lawn of the cathedral. He sustained a lump and bruise, and the pain was so intense that he had to be taken to the ED for the treatment. The ED physician was uncertain and concerned about the lump on the patient's thigh, so he asked the dermatologist on call to diagnose the suspicion lump. The dermatologist diagnosed the patient with 2.5 centimeter benign tumor of the right thigh and recommended that he follows up with the dermatologist for the treatment. 2 weeks later, the patient arrives to the dermatologist for the excision of the benign tumor. The patient was prepped, draped, and anesthetized appropriately. The physician makes an incision over the tumor through the skin, subcutaneous tissue, and a muscle. The tumor was visualized and then removed. The site was flushed with saline, hemostasis was achieved with the electrocautery. The site was closed with suture in layers. Which procedure code best describes this encounter? Let us see what are the options has been given to us. First is 11404, that is definitely the 10,000 series, and then we have some more code. So we will see all the codes and then we'll finalize our answer. So if you see 11404, it is the code from the integumentary system, and I have told you that whenever it has reaches the muscle, that means it has gone deep, and that's why we will come to the musculoskeletal system. And remember, the site was flushed with a saline, hemostasis was achieved with the electrocautery, the site was closed with suture in layers, that means the intermediate repair has happened, but we have the guideline that intermediate repair is included in the excision of the musculoskeletal system. So we cannot code the 27328 and 12031. So that's not the correct answer. So we'll eliminate the answer B, we eliminate the answer C because this is the integumentary system and our tumor has gone till the muscle. Now 27328 is the excision tumor soft tissue of the thigh or the knee area, subfacial, lies intramuscular less than 5 centimeter. And where was the tumor? The tumor was till the muscle. So it is definitely the 27328. That's the code that I will take. And that's why D is the right option. A 45-year-old male present to the operating room with a painful mass of the right arm. General anesthesia was induced. Soft tissue dissection was carried down through the proximal aspect of the teres minus muscle. Upon further dissection, a large mass was noted just distal to the inferior glomerulohumeral ligament, which appears to be benign in nature. With a blunt dissection and electrocautery, a 4.5 centimeter mass was removed en bloc and sent to pathology. The wound was irrigated. The repair of the teres minus with a subcutaneous tissue was then closed with a triple O vicryl. Skin was closed with a double O proline in subcuticular fashion. What is the correct CPT code? And we have the option 23076, which is talks about the excision of the tumor soft tissue of the shoulder area, subfacial and intramuscular. 23066, biopsy of the soft tissue of the shoulder area, superficial, sorry, it's a deep one. 23075 is the excision tumor soft tissue of the shoulder area, subcutaneous, less than 3 centimeter. And 23077, that we'll see. So let us see what our answer is. So if you see this particular case, we need to eliminate the wrong answer. And 23066 is the biopsy of the soft tissue of the shoulder area, deep. So that didn't happen. There is an excision that has happened, and we need to check out which is the correct code, whether 23075 or 23076. So here the rationale for the answer is given and the answer is 23076, and it is used because the mass was deep, distal to the IGHL, dissecting down through the teres minor muscle, and that's why we are looking for the intramuscular, not the subcutaneous, because below the subcutaneous we will have the muscle and they went through the intramuscular through the muscle, and the dissection continued till the distal to the IGHA. So remember that these are very important consideration whenever we are looking for this excision, where is that excision, how deep the excision has been done. So the next important topic is the introduction and removal. And in this particular topic, we mainly insert or remove the devices, substances into the joint or the surrounding areas within the musculoskeletal system. These codes are used for the procedure like injection or injecting the medication into the joint, placing the spacer device within the joint, removing the previously implanted drug delivery devices from the joint, or application of the implant, removal of the foreign body. So all that comes under introduction and removal. So these are the code you will see under the introduction and removal, and if you study them, it is injection of the sinus tract, removal of the foreign body, injection of the therapeutic, local anesthetic for the carpal tunnel, injection of the enzyme. So various kinds of injections that comes into this particular introduction. Under introduction they have discussed, then there is a needle insertion, there is a placement of the needle or catheter. So you need to read the code language very carefully before picking up the code. So let us take one more example. Which code would you report for an aspiration and injection of the ganglion cyst to the bone of the left greater toe? And we have an option 20600. It talks about the arthrocentesis, aspiration and injection. So definitely the arthrocentesis didn't happen here. So we will leave the code 20600. 20612, it is the code aspiration and injection of the ganglion cyst any location. And we have this code which is very specific. So we will look to this code. And 20615, aspiration and injection for the treatment of the bone cyst. So after looking at all the codes, we know what is the code. So the code 20612, it is a very specific. It talks about the aspiration, injection, ganglion cyst, and any location. And that's why 20612 is the correct. Now let us take one more example. This is a 32-year-old female who presents today with a sacroiliitis. On the physical exam, there was a pain on palpation of the left and the right sacroiliac joint, and a fluoroscopic guidance was taken for the needle positioning. Then 80 milligram of dipomedrol and 1 milliliter of bupivacaine was injected into the left and right sacroiliac joint with a 22 gauge needle. The patient was able to walk from the exam room without difficulty. Follow-up will be needed. Now we will see what are the options we have. 20611, it talks about the arthrocentesis with the ultrasound guidance, because this is indented code. So I'm going to read the above code till the semicolon. So arthrocentesis, aspiration and injection major joint of or bursa with image guidance. That didn't happen. So 20611 is not my code. 27096, it talks about injection procedure for the sacroiliac joint, anesthetic steroid with the image guidance. And yes, we have taken the image guidance, fluoroscopic, that is included. So this is my code. But the code language includes the image guidance. So there is no need to write 77012. So that's why this is not the correct way to write the code, because the code includes the image guidance. Now check the 27096. This is the code, again the same code, and there is a parenthetical note that for a bilateral procedure use modifier. And here we have used it for the left and right sacroiliac joint. So 27096 and 50. And this is the 27096, 27096, 51, and again they have put the 77012. So option D is not the correct answer. B is also not the correct answer. 20611 talks about arthrocentesis ultrasound guidance, and that's also not the correct code. So the right code is 2709650. Now next important point is a trigger point injection. A trigger point injection is an injection that is given directly into the trigger point for pain management. The injection may be of anesthetic. And the coding tip is, whenever we are giving the trigger point injection, we count the number of the muscle where the injection is given. We do not count the number of the injection. This is a very important tip, that we always count the number of the muscles but not the number of the injections. Now let us take example. 39-year-old involved in a motor vehicle accident a year ago arrives to the pain clinic with a complaint of neck pain and left-sided radiculopathy complicated by the cervical degenerative disc disease. NSAID and physical therapy have been unsuccessful, and the patient requires a multiple trigger point injection. The left multifidus, trapezius and right levator scapulae were injected. The area was clean and bandage applied. Which procedure could best describe the encounter? So we have 20552, 553, 20610 and 20553 into 3. So let us see our answer. So this is the case of trigger point injection, and this trigger point injection is multiple trigger point injections are given into three muscles. What are these? Left multifidus, trapezius and right levator scapulae. So let us see what is our first option. It is 20552. It talks about the injection single or multiple but one or two muscles, and we count the number of the muscles. So let us see what is the code 20553. Single or multiple trigger point, 3 or more muscle. So we will definitely require this code. 20610, it talks about the arthrocentesis, that didn't happen. And 20553 into 3. This is not the way we will write, because when I write 20553, it covers three or more muscles. So there is no need to write like this. This is absolutely wrong. So the ideal answer is B. So let us take one more example. Patient complains of chronic and acute arm and shoulder pain following the bilateral carpal tunnel surgery. Patient is followed by the pain management of over a year. Physician finally diagnosed the patient with a reflective dystrophy syndrome. The physician performed the six trigger point injection into four muscles group. So what is the CPT procedure code? So we know our drill that whenever the trigger point injection is given, we do not count how many injection, we count the number of the muscles, and here the number of the muscles are 4. So by putting that logic, we know what is the answer. Our answer will be 20553 because the code talks about the single or multiple trigger point injection, 3 or more. Our muscles are 4, so we will zero down our answer 20553. The next important topic is the arthrocentesis. Arthra means joint, centesis removal of the synovial fluid. Many a time they ask this medical terminology, so you need to pay attention to this arthrocentesis. Now what is important points to remember? Identify the joint, whether minor or intermediate or major joint. Identify whether it is done by using with or without guidance. If with guidance means use the appropriate code for the guidance, and always see the notes below the code to lead the correct answer without careless error. So these are the code in your book and they are for the arthrocentesis, and you will see that arthrocentesis codes are divided depending on the size of the joint, and everything is very clearly given. The arthrocentesis, aspiration and or injection, and then the intermediate joint, the name of the joint is also given, and this is the without ultrasound guidance, this is the code with the ultrasound guidance, and similarly you have the major joint. I have taken the snapshot of all these codes here so you will have a better understanding. This is the code for the small joint, and without ultrasound guidance this is the code for with ultrasound guidance. So every joint has the the site wise or the size wise differentiation, and without and with ultrasound guidance. The code below, the parenthetical note below every code is very very important, and one must pay attention to it, that if the these codes are mainly for the ultrasound. So if the CT MRI guidance is taken, then we need to add this additional code, because though the codes are for the ultrasound, and I have given here do not report 20600 and 20604 in conjunction with 76942, because those code 20600 it is without the ultrasound guidance, and even 20604 is with the ultrasound guidance. So one must pay attention where to put the 70,000 series code and where not to put the 70,000 series code. So pay attention to the language of the code. Now this is a diagrammatic presentation of the external fixation system, and that comes under introduction and removal. So in this introduction we are introducing the external fixation system, and in this external fixation system we have a uniplane system where all the screws are in the same plane, and multiplane where all the screws are in a different plane. And then we have a hollow application, that is also one of the important thing. Pay attention to the anatomical side, and are you introducing and or are you removing? Most of the code talks about, especially as far as the external fixation device is concerned, most of the code has introduction and the removal into one code. So I'm going to give you a snapshot of that so that you will understand. So if you see the code language here it is the insertion of the wire pin with application of the skeleton traction, including removal. Most of these codes are application as well as the removal, but here it is a wire or a pin. Here it is a cranial tongue, caliper, stereotactic frame, application and removal. Here also application of the halo including removal. And whenever it is a halo, you have to pay attention to the anatomic site, whether it is a cranial, whether it is a pelvic, or whether it is a removal. And these two codes are important because 20665 and 20670, these are the code only removal where the introduction is not covered. So if the application and removal is by the different provider, let's say one provider has only applied and the second provider has removed that system, maybe the first provider wasn't present or he left the hospital. So in that case, when we do only, so the second provider has done only the removal, he is going to use this code. Okay, because most of the code talks about application removal, application removal, application removal. So that's why pay attention to that. So let us take one example to test this guideline. Dr. Divine applied a cranial hollow to Gary to stabilize the cervical spine in preparation for the X-ray and subsequent surgery. The scalp was sterilized and local anesthesia injected over a pin insertion site. Posterior and anterior cranial pins are inserted and the hollow device attached. Now let us see what are our code. 20664, application of the hollow including removal cranial 6 or more pins placed for a thin skin skull osteology. So this is a particular code which also talks about the cranial hollow, but they have given a specific case that the patient who is a pediatric with a hydrocephalus, and for him if we are applying the halo, then it is a 20664. But this is a 2061 is the application of the halo including the removal cranial. So this is a more accurate code 20661. Now 96372, it talks about the therapeutic, prophylactic or diagnostic injection, specify substance or drug. Here they have given the local anesthesia, but remember whenever we give the local anesthesia, it is always included in the procedure code. So there is no need to write a special code for the local anesthesia. So the right answer will be 20661. This was our last slide. So we will stop here and the remaining topic will continue in the next part.